everyone, and thank you for joining us for this. And first, designation as a Level 4 trauma center. I want to thank Carson Valley for working with the health division and the EMS staff to bring this together. This legislation was passed in the 2025 legislature. So since that bill was enacted, we've been working with Jeff and his staff to bring this together. They've essentially been doing this for several years, and I'll let him speak to that, but that's why they had everything ready. That's why they made this process very seamless, and we're looking forward to this as it moving forward, using it as a guide for other hospitals within the state that decide that they want to take this next step and increase some of the health care provided, not only to our EMS providers, but to those patients that come through the front doors of our facilities. My name is Bobby Sullivan, and I'm the program manager for the EMS office, but now I want to pass this over to Jeff Prater and let him pass along the good information.
Awesome. Well, thank you. All right, I have a 3-hour speech. All right, first and foremost, the main thing I want to do is just thank you guys for your partnership as well, the entire team. I know the conversations we've had over the telephone the last couple of weeks, months, I think have been instrumental in helping us as well understand where you guys were headed with the designation. It's new to the state, and but thank you guys for the partnership. I think I would be remiss if I didn't make sure that, at Carson Valley Health, we have a great board of directors, and Dr. Fry is here to represent. And Dr. Fry, I want to thank you very much for representing the board today, and thanks for the board's support in this. I know we brought it up to the board several months ago, almost a year ago now, and they were totally supportive from the moment that we brought it up. And so thank you for that. Also, Assemblyman Koenig, who can't be here today, I wanted to thank him. He was instrumental in making sure that AB 326 was passed. He was the sponsor for that bill. And also for Assemblyman, I can say that now, I got to remember how to address you now, Blaine Osborne, who was also instrumental in that. At that time, his role at NRHP as our president there, so thank you for that, and instrumental in making this happen. Tahoe Emergency Physicians, if you ever want to work with a great group, number one, you can't have them, they're ours, but such a great group of emergency room physicians to work with. And I just want to thank Dr. Glonner, who's our director of our emergency room, for all your support and things, and what you've done for us in making this happen. And Dr. Elliott, who is now, I can't say trauma director now, I say level 4 trauma director now. So thank you for your leadership in making sure everyone's doing what they're supposed to do. So thank you for that. Where's Monica? Oh, right there. Yeah, and so Monica, who is our emergency room manager, doing all the heavy lifting and making sure that everyone's got the protocols taken care of, and making sure that we're ready to go for today. So thank you for all your hard work. Where's Maria? Maria and I. So I remember about 7.5 years ago we had this conversation. Is that about that time? Wow. It's been a minute, and we thought this day would never come. So thank you for all your hard work, and as our trauma coordinator, and making sure that everything was placed into the trauma registry. And so thank you for that, and thanks for all your hard work. And then lastly, to all the emergency room staff. I know all the hard work, and I know the prodding from Monica that's going on. So I just want to thank all the emergency room staff for all their hard work and dedication to that. So today is for me, a historic day for not just for Carson Valley Health, but also for the state trauma as it pertains to the trauma system. And a lot of times, we think through, trauma. We think mainly about the urban setting and things that happen in the urban area and the traumas that happen there. But what a lot of times we don't really think through is what happens in the rural areas, in rural trauma. When it comes to rural trauma, a lot of times what happens, we have a big delay when it comes to finding patients in the rural areas. So having a delay in finding a patient, having delays in transport of patients, and then just that long time between the time that they're found, transported, and then just have that initial contact with the emergency room physician really creates and increases that mortality rate that we see is about 3 times longer in rural areas as we do in our urban counterparts. But I would also say that, a lot of times, and I have been asked this question several times. So Jeff, you're going to start seeing trauma patients now? No, not today. As soon as we get a certificate here in a few minutes, no. We've been seeing trauma patients for many, many years. As a matter of fact, so far in 2025, the last count I had, the last report I had, Over 250 traumas have come through our doors. And that is in a rural area. A lot of times those trauma patients come through in their personal vehicle. Only about a third come through an ambulance setting in rural areas. And because of the type of care that we're able to provide at Carson Valley Health, only about 1 or 2 a week have to be transferred out to a higher level of care because of that. So just want to say thanks to our team, but also want to give Dr. Glunner an opportunity to say a few words, because you've heard enough from me. And so come on up.
All right. I'm Kathy Glonner. I'm one of the Tahoe emergency physicians, and speaking on behalf of our group, we are really honored to be a part of this process and to have been able to represent this area in a way that just really brings some recognition to the service that's provided by this hospital and health system. I think Mr. Prater has really singled out all the right people who put years of work into this. And all the people who didn't complain, as we were saying, can we please follow these guidelines as we work toward this kind of the culmination of all that hard work. The one person I would add in who he didn't mention is Mr. Prater himself, who has really spearheaded this effort and made it happen. You know, he just kept those fires burning and contacted all the right people and put in so much effort to help our emergency department and this hospital be a better place for all of us to work and for all the patients who come in and receive services here. We're really proud and happy to be a part of this, and thank you to the state for accepting our application and providing us with this opportunity.
Awesome.
Okay, thanks.
I did forget one more group. I just wanted to thank Joey and Battleborn, as well as one of our newest partners in what we do at Carson Valley Health, just really being that true partner for us. And East Fork Fire, I don't see representing here today, but also a shout out to them as well. Just being a partner with Carson Valley Health along with Battleborn has just been a great addition to the Carson Valley family. So, Bobby? In a moment we've all been waiting for.
So we completed the final inspection early this morning. No issues noted during that inspection. It went just as we anticipated that it would. And at this time, I'd like to present to you and to Carson Valley Health the certificate outlining your designation as a Level 4 Trauma Center.
Awesome. Thank you very much. What do we have?